Josiah, welcome along to the podcast. It's good to have you back with us, mate.
It's very good to be here.
We are talking about your latest column where you take aim at the health system in New Zealand.
That's right.
Time to trade in. New Zealand healthcare needs an upgrade. And your opening sentence, very telling. The New Zealand health system is on life support. And you're not just talking about the $1.4 billion missing money. Tell us what it is that's causing the system to kind of die a slow, painful death.
I think there are two things going on. You've got the political drama of the $1.4 billion hole that you've identified. If you just slow down and stop there for a second, we're in March of this year. Everything's fine. The board have all that they need to manage the resources and make sure that our health system's functioning as it should. 5 days later, and there's a letter. The Health Minister, Shane Reddy, receives that letter. Suddenly, things aren't good. We've got the drama that we have today. Still took, 3 months, July, for the board to be sacked. But this is actually taking up a lot of our attention. This sort of political drama, finger pointing, whose fault is it? Labor saying, national government can't be trusted. National saying, it's all the centralisation and bureaucracy that's at fault. So whose fault is it? I don't know, but it doesn't really matter because now we have a health commissioner appointed to fix the issue. But really, I think the focus needs to shift from some of that political sort of drama and finger pointing and really come back to what's the issue. And the issue is we don't have the space we need to treat our patients and we don't have the staff we need to administer that treatment. So that's really what it is in a nutshell. And that sounds simple. The solution is a little bit more complicated.
So you've outlined some of the symptoms of that in your column. What are examples that you give us of this health system that's failing? Because it's not just like you say, it's not just the political, we're missing $1.4 billion, but there's a whole bunch of flow-on effects from that. You say people are suffering.
Yep.
So what does that look like?
Well, recently Dargaville Hospital was in the news. There are periods of time at that hospital, where there was no doctor. That's weird. It's like a sea without fish. Doctors belong in hospitals.
Yes, that's kind of what you expect at least a hospital to have, like a doctor.
Yeah. And unfortunately, a man had a cardiac arrest at the hospital at a time where there was no doctor. There was a nurse there. They were connected to a doctor 40 kilometers away who was receiving providing instructions about how to deal with this patient undergoing this cardiac event.
That sounds almost third world in the sense that like you'd expect in the third world someone to be zoomed in to provide directions over the phone.
Yep,
for
totally.
Whatever. Yeah,
and we claim to be.
And this is in Dargaville.
Yeah, that's right. We claim to be, first world in terms of health, but this is sounding a lot more like third world. 2 days ago, RNZ reported that Wairarapa Hospital was down 40 nurses. And you go, okay, well, that's not good. But then when you hear that actually the centralised bureaucracy are only advertising for 1 or 2 jobs to fill those hospitals, you start to go, hang on a minute, what's going on?
Yeah. So we're down 40, but we're going to replace them with 2.
Well,
1 or 2.
Unless something changes, and that was after them receiving assurances that the hiring freeze wouldn't affect frontline workers. Okay. Wait times of anywhere between sort of 7 to 10 hours can be expected when people are referred to the emergency department. I read a letter from a guy on the North Shore who wrote to the Herald, and his account was recorded in a piece, and he explained that he was referred to the emergency department at North Shore Hospital, and he wasn't seen for 10 hours. And during that time, he waited in the general waiting room. People were being brought in by by ambulances. But during that time, he was relegated to a corridor that was passing for a ward. So not only did they not have the staff needed to provide the care in a timely manner,
10 hours,
but they also didn't have the physical space to house people adequately while they waited. I know someone who went to the hospital recently. They waited 7 hours to see a doctor, and that was after feeling chest pain. So that bumped them to the top of the queue.
Yeah,
but it was still 7 hours.
Yeah, that's right. So I mean, it's like, well, that's good news, but you're still waiting a long time.
So these wait times are just they're common. They're not horror stories.
So we've got a new commissioner, as you mentioned. We've got this system on life support. Surely the commissioner should be able to do something to fix this. But from what I understand, their job is to just focus on decentralizing and stop spending so much money.
Yeah, and those are admirable goals. We do want to cut wasteful spending. We do want to cut bureaucracy so that the decision making is as close to the front line as possible. So admirable goals. Maybe he's able to achieve that. But really, this is another example of tinkering, which we've had for the last 40 odd years longer, where we've been sort of going through this process of centralization, decentralization, expansion, contraction, all of these changes, but they really haven't changed the core of our system. And that system is becoming increasingly unsustainable. We have an aging demographic, meaning that the tax take is going to be lower and lower as time goes on, while the health needs of our population go up. That's a real problem. So in terms of sort of long-term planning and sustainability, now's really the time to start thinking about that. The signals being sent by the government at the moment is really just sort of managing the crisis at hand. Well, that's not really good enough.
So we've got a crisis. We need to manage it. Okay, once we get through that, or while we're getting through that, long-term thinking, what does that look like so that we can have a health system that's not only fit for purpose, but will take us, years into the future?
Yeah. Every other solution that is prescribed to help is going to take time. To train new doctors, it's going to take time. To train new nurses, time. Build infrastructure, time. So we really need to be retaining staff now. There is no lag time on that. So that looks like more competitive pay, yes. But maybe more importantly, it looks like improving the working conditions for our staff at the moment. Many are leaving the profession to go and do something else here within New Zealand, or they're being pushed to go overseas. So they want to stay within the medical field, but they don't want to work here because they're understaffed. Their scheduling is inflexible, meaning that they're not able to maintain their family commitments that they would otherwise. I mean, there are a whole raft of factors making the current situation untenable for people, which puts further burden on the people who remain, which leads to further people exiting due to burnout. So really addressing that issue is quite key. The second thing I'd say is we need to move a lot of our healthcare delivery from the hospitals into the community. And so that's where GPs really come in. They are so important to the health of our broader ecosystem. But our issue is that we have to recruit 300 doctors every year for the next 10 years just to stay still.
So not even to have more doctors, but because of people leaving, retiring, changing careers or whatever, 300 doctors a year.
Yeah. A recent survey found that 37% of GPs intend to retire by 2027. That's 55% by 2032.
So half our doctors will be gone in less than 10 years, in 8 years' time.
That's right.
Okay, so staff retention really jumps to the top of the list.
It really does matter, particularly when we're not even that attractive to overseas, doctors, medical professionals who might consider working within an English-speaking country. So you've got Australia, you've got Canada, you've got the US, you've got the UK, who are all in different ways more appealing prospects than here.
Yeah.
And part of it actually comes down to workforce planning. I heard one stat that we lose a third of surgeons within the first 5 years of them receiving their qualification.
They just go overseas.
Yeah. Emeritus Professor Des Gorman said that it's sheer good luck if a surgeon lands a good job here in New Zealand. So a lot of the time it's simply a case of, well, there's nothing for me here. I'll go overseas and find a suitable job. I heard something else which was very interesting, is that yes, we do need to be recruiting more doctors, and it's at that entry level, more students coming through. We do need that. But largely it's sort of the specialists down the line who we're increasingly losing. That'll become worse as more people retire. But you need those people, those specialists in the upper echelons of the medical field to be able to train and equip those coming up.
Otherwise you just lose the knowledge, right? And it's gone. And then there's a big gap and no one can fill that gap.
Yeah, and so much of the way healthcare works is by hierarchies, where certain people have certain knowledge and skills who are able to say, well, this is what needs to be done. When there are fewer and fewer people at the top to make those decisions, things slow down incredibly. And that's partly the issue with bureaucracy.
Okay, so better working conditions, just more attractive maybe salaries, work-life balance, that sort of thing, devolving healthcare away from the hospitals back to GPs. Anything else?
Yeah, I mean, there are nurse practitioners who can diagnose, manage, and treat patients in ways that regular registered nurses can't. So looking to train more of them. I know that pharmacists around the world can do more than they can do here, including prescribing medication and providing some of that immediate care. So again, that would alleviate the burden from GPs and downstream, hospitals. So really finding ways to unlock the potential of our workforce is quite critical to easing the burden that our health system's facing at the moment.
Well, as you say, it's on life support. Hopefully someone will hear this podcast and take up these suggestions, and we'll be in a very different place in a year or a couple of years' time. Josiah, thanks for being with us.
Thanks for having me. The New Zealand health system is on life support. Hospitals don't have doctors, newly built facilities sit empty, and patients endure agonising wait times. Crisis might describe the situation if the word still had any meaning. The problem is simple. Kiwis are not getting timely care due to space and staff shortages. While political drama swirls around Health New Zealand's $1.4 billion deficit, people suffer. Now we have a commissioner tasked with fixing our health system. Can one man succeed where others have failed? Will more tinkering with decades of tweaks help? Insanity is repetition with the expectation of different results. As long as we rely on patch-up jobs, stories of public healthcare failures will persist. Consider these examples. A man referred by his GP to North Shore Hospital's emergency department waited 10 hours to see a doctor, relegated to a corridor passing for a ward. In another instance, a newly opened 150-bed facility that promised to slash surgery wait times has failed to treat additional patients. Operating theatres elsewhere closed to staff it. This understaffing issue has become a self-fulfilling prophecy. As workloads increase, fewer people want to remain in New Zealand's public health system. A student doctor revealed to me that many of her peers plan to work overseas. According to the New Zealand Medical Journal, reasons include, quote, excessive workloads, significant on-call duties, long hours, and unpaid administrative tasks, end quote. And doctors aren't the only ones feeling the heat. A medical laboratory scientist told me that their department has been down a full-time equivalent for more than 3 months despite prior warning. The position was advertised and people applied, but central management failed to approve the hire. They didn't reject it though. They just didn't respond. A centralised bureaucracy will do that. If our health system were a vehicle, you'd say smoke is pouring from the proverbial car bonnet, obscuring our view as we hurtle toward oblivion. It's clear that we need to train and retain more health professionals. A report titled Lifeline for Health found that more than 300 GPs need to join the workforce every year for the next decade just to maintain our rate of GPs per capita. This is partly due to an ageing workforce. A 2022 survey found that 37% of GPs intend to retire by 2027 and 55% by 2032. Staff retention is somewhat dependent on competitive pay with Australia, which may require different funding or delivery models to achieve. But equally important are steps toward improving working conditions for medical staff who report alarming levels of burnout. By identifying opportunities to develop our existing workforce, we can maximise output and alleviate burdens elsewhere. More nurse practitioners could be part of the solution, being able to diagnose, treat, and manage patients in ways that registered nurses cannot. The government needs to be more ambitious in its problem solving. Reducing bureaucracy and wasteful spending will help, but fine-tuning an old Volkswagen Beetle won't win us any races. In fact, it's got us where we are now.